Namaste, everyone. It is honor to be here today as I share insights on the subject that beautifully bridge ancient wisdom and the modern science. That's our ancient Ayurvedic therapeutic tools to boost your mental health. We are living in a time where anxiety, depression, stress-related disorders, and cognitive decline are affecting people across all age groups, not your, mine, or above 35, but everyone, just like the kid who is going in a first standard also, because he is also have anxiety. But that if the answer to better mental realize license or emotional stability and cognitive clarity lie in tools developed thousands of years ago, which is in Ayurveda. As a practitioner of the Ayurveda and student of the modern neuroscience, I believe that ancient tools like the meditation, yoga, nootropics, that's Ayurvedic nootropics also, and the Ayurvedic therapies are not just relevant today, they are essential in combating our growing mental health crisis. Let us explore the 5 powerful Ayurvedic tools that enhance mental health and are now being validated by the modern neuroscience also. It's a backing to, you can see it's a backing by the neuroscience, because there are a lot of researches are going on. In the word, when we say research, that means something is searched and now we are researching it. So everything is there, now we are researching it. So first topic, which will be, is it my slide? I'm not able to see the slide is, the second slide is there. Just going to discuss about the 4 things, and we are discussing about the how the tools we are going to use for our patients and for the well-being of our society. So meditation, everybody know the meditation, that's a, a training to a mind, we can say rewiring the brain. In Ayurveda it is known as the dhyan. uh, Everybody must know about this word dhyan, that is the Gautam Buddha's position, which is the dhyana mudra, or we can say the meditation. It's a fundamental, you can say the a meditation is the foundational mental hygiene practice, and which is called as a dhyan. Thousands of years ago, our seers prescribe it is to be stabilize the manas, that is a mind. Manas is a Sanskrit word for the mind, and connect with inner self. Now these are the very heavy words for I think other people, but most of the people are working with a mind, so these are the very common things, and so many words we are um, used to, because we are hearing every time with the yoga, when yoga is very famous nowadays in a western side also. So today neuroscience confirm these benefits through a concept called neuroplasticity. So this word is very famous. And what is a neuroplasticity? The brain's ability to rewire itself based on the experience. Now, the functional MRI studies showed that the regular meditation enhanced the prefrontal context that is associated with the exclusive functions like the focus, planning, and emotion regulations, and reduces the size of the amygdala, which governs our fear and stress response. A 2011, that is the Harvard study by the Sarah Lizar, demonstrated that just 8 weeks of the mindfulness meditation could increase the cortical thickness, which is very important thing. That is, cortical thickness is observed to be increased in the hippocampus and the responsible for the learning and the memory. Now, in Ayurvedic terms, if we've seen the balance, which is the sadhak pitta. Now, these are the Sanskrit words what I'm utilizing. I'm using. Afterward, I will give you the this slides so that we can share with the other people also. And the Tarpak Kapha. Now, the Tarpak Kapha and the Sadhak Pitta, these all are specifically the emotions and the nourishing the nervous system. And basically, this both we can see when, according to the Ayurveda, at the positioning of the heart. So when we are saying the manas, man, and we are saying the brain at the same time, these both the things can be visualized or can consider in the both the places, in the brain as well as in the heart. Now the second point is the yoga. This is the second tool, yoga and pranayam. So basically yoga is the, you can say the misleading of the word, or you can say this is a basic word is a yoga means that is a joint of inner soul to the outer soul, that is the inner pran to the outer pran is the breathing. So alignment of the body, breathe and brain is the basic concept when we are saying the yoga and a pranayam. Yoga is just a physical exercise. It is a neurological reset. When we can neuro physiological reset when says, then asana combined with the pranayam. It's a controlled breathing. It's a directly influence to autonomic nervous system, shifted to the balance from the fight symptomatic mode to the calming the parasympathetic mode. Research shows that alternate nostrils breathing, which is called as a nadi shodhan, and Brahmari pranayam can reduce the cortisol level, increases the GABA, which is the gamma aminobutyric acid, and improves the connectivity between the insula and the prefrontal cortex, enhancing interconceptions, that is self-awareness and mood regulations. So basically, if we can do handle without medicines all these things, then it is a beneficial for everyone. And kids also can, if we guide the kids properly, the people, the patients who are kids or well educated also, who are want to avoid the medicines, they can utilize such a type of therapies at least for the 30 days, and they can see the results, how they are feel and how the correction is there. From the Ayurvedic perspective, if you see, this harmonies is a vata dosh, calms nervous system and supports the pranavat, which governs with the mental activities according to the Ayurveda. Now the third most important is the Ayurvedic nootropics. The plants which is used for the brain's health is called nootropics. Just like the Brahmi, Ashwagandha, curcumin, that's a turmeric. Long before the term nootropics entered the modern lexicon, and Ayurveda had already developed the system called Medhya Rasayan. So we customize the Medhya Rasayan. Actually, in our manufacturing unit also, Medhya Rasayan is specifically we created for the gurus comes from the Australia. The Australian monks who comes for the meditations for the 3 months in a Ganeshpuri area near the Mumbai, and we are creating this Medhya Rasayan according to their pulse, so that they took these medicines repeatedly they are taking before the pranayam. So this is a detox procedures is going on, and they made their rasayan is giving the boost to their brain. They are herbs. They enhance the intellect, memory, and emotional stability. Now, few Ayurvedic nootropics which supports the modern research, which is the Bacopa Manori, which is the Brahmi, known as the memory booster, is it is the modulate leaves of neutrosmeter, or you can say like the contents are the acetylcholine and the supports the uh, synaptogenesis, as well as the clinical trials have shows the improvement in the memory, attentions, and the anxiety reductions. Ashwagandha is also, which is a Withania somnifera, which is also giving the very good results in the chronic stress and anxiety. And it's confirmed that uh, the randomized controlled trials, when it happens at that times, it shows that this adaptogen reduces cortisol, supports neurogenesis, and protects against the neurodegenerations. So these are the backed by the um, modern science. Now the curcumin, everyone know the benefits of the curcumin. This is the powerful anti-inflammatory and antioxidant. It crosses the blood-brain barrier and modulate the BDNF, which is the brain-derived neurotrophic factor, which improves the moods and protecting the against the depression. So collectively, what Ayurveda says, it supports to ojas. Now this is the different word. Ojas. Ojas is the purest form of the um, Saptadhatu. Now, Saptadhatu is a definition. I have to give the full definition. That is, each whatever we eat, everything is converted to to another dhatu. Dhatu, the definition of the dhatu is whatever is dhareti. It is dhatu. Whatever we are made up of is each element is called as a dhatu, and there are the seven dhatus, and this is the ashtam dhatu, which is the purest form. And the who have the ojas is the best one. They are very mindful, they are very intellectual, they are very um, having the very good aura, such type of qualities they have. Now the fourth one, tools, which is in Ayurveda specifically we utilize, is the shirodhara, which is a healing the mind through the forehead. Now, how it we perform? We use the this is one of the therapy which continuously we pouring the medicated oil or the decoctions, particularly on the Ajna chakra, which is the third eye, which is called as the third eye center eye, which is on a forehead, and from the we can say from a neurological perspective, we've seen this is representative of a rhythmic stimulation which activate the parasympathetic nervous system, shows down EEG brain waves to alpha and theta states. The same seen in deep relaxation as well as the early sleep, and reduces the sympathetic overdrive. Studies using the EEG and the HRV, that's a heart rate variability, have demonstrated that the Shirodhara reduces the anxiety, promotes the deep sleep, and may help with the insomnia and hypertension also. Ayurveda believes that it's a Vata dosha and nourishes the Majja Dhatu. Again, these are the Sanskrit terms, and Majja Dhatu is the one of the Dhatu which is in a, we can say, the bone marrow. It's a Majja Dhatu, the brain and the nervous system, the revitalization of the mind body axis. The last one tool, what I have to suggest is a Marma Chikitsa. Now, this is the tool we can utilize for our patients very easily, or you can suggest advice to anyone who have the anxiety, who have the issues, just like Dr. Murthy was telling about the hmm, there is a nuclear families, and because of the nuclear families there is no back support. Otherwise, in Indian families in earlier stage, or nowadays we are also nuclear in converting into nuclear families, but the combined families was there are so many people are in the families and who are the supportive. If so many people are around you or you're attached with a number of people, then that anxiety things comes down automatically, because you having the every time your attention is grabbing by someone else or you are getting someone's attention. So this one Marma Chikitsa, which is a activity which is neural gateways, you can say. That's a why I'm saying that's activating the neural gateways, because Marma Chikitsa is the particularly the Ayurvedic system stimulating vital points, and it is a correspondent to nerve endings, joints, and pressure points. So in our body, there are the 107 Marma points. And what exactly the Marma points are there? Marma points are at the end of the nervous system and where is the pranavayu is there. So these are the vital points, we can say. And there is a gentle pressure or stimulation of the specific marmas, specifically though those are the head, neck, spine, can release the blockages of the energy and giving and relieve from the emotional stress. Basically, if any of the patient who is having a lot of stress, anxiety because of their past life, Not I'm saying the past, in between their childhood memories, or maybe in a adulthood memories, but there are the memories which considered as a past life, which is a bad past life. So how we have to nullify that? So you can see my palm, it's a left, my left hand, and here in between the thumb and first finger, index finger, there is a one point, and if I'm pressing this one, so if there are the blocks in my mind, there are the old memories are there. If I press this one, I have a pain. If there is a no blocks, there is a no pain. So this is called as a delete point. So anybody can do this. If anybody have their bad memories, they have to remove it. How they are going to remove it? After having your dinner, relax, sit in front of the mirror, press this point 6 into 6 time. That's 6 time. There is a one pause. Then again 6 time. This 6 into 6 time you have to do. And then after, you have to just hold this hand like this. And remember that situation which is hurting you, but not involving in that situation, but see that situation as a third person, and just calm yourself, relax yourself, and just, if you are hurt that time, you just say, okay, I'm going to forgive that person. That is the situation of the time. That is that situation. That's a bad situation. Nobody is guilty for that. And I'm going to forgive the person, and I'm going to delete that moment from my mind. See how you can sleep at that night. And take my word that that thing will be automatically deleted from your brain. And ultimately, what are my experience when I'm doing these therapies with a lot of patients, then ultimately whatever medicines, a small dose of Ayurvedic medicine I'm giving, that's 100% working, because that block is removed. And this is the magic of the Marma Chikitsa. So specifically, this is the acupressure point, but these are the neurovascular bundles and the acupressure point together, and this called as the Marma, or you can say this is the vital point. Scientifically, studies indicate the Marma therapy may improve the vagal tone, enhance relaxation, and regulate brain-heart coherence. In essence, it awake the dormant neurological circuits, allow prana to flow freely. So these are the few things. So basically, conclusion of my speech is that returning on the ancient and modern science, when we are reuniting these two things, so meditation, yoga, herbal nootropics, shirodhara, and marma therapy are the best five things which you can utilize, and three or four of them you can utilize every day, and within 30 days you can see how you are recovering, or your patient is recovering. Thank you very much for giving me this honor. Thank you everyone that you are listening me so uh, quietly. And please, if you have any questions, you can go for it.
Thank you. Thank you so much, Dr. Ashish. We are very grateful for your expertise and advice and some of the very pragmatic techniques that you have taught us during the session. And thank you so much for such an elaborate, stupendous presentation. So, Dr. Ashish, I want to tell you that I have been an ardent follower of Ayurveda, yoga, and Panchkarma. I have been following yoga for many, many years. And
Wow.
needless to say that I have seen immense benefits within myself, not just physically, but also at the soul level too. So definitely, I have gained a lot of from yoga and Ayurveda. I want to just ask you, on an average, what is the duration of these therapies? Because majority of the decoction can be taken for the duration of 3 to 4 months, if I'm not wrong. Yeah, can you please
Correct.
clarify? Yeah.
Yes, any of the decoction, if you are taking, that is not more than 3 months. And basically, what we do for everybody it is not possible to visit doctors every time, so we teach the patient that what decoctions they have to take, how they have to take, how to cook they have in a
Hmm.
kitchen. And that type of decoctions, if they are taking a fresh decoctions, then it is a more beneficial. But simultaneously it's a 3 months decoctions. If they are having, they have to shift to the another decoction, or they have to take a gap of at least 1 month for that decoctions. Otherwise
Okay.
it will be resist, as well as it will anything whatever you are eating is a medicine, and medicines have the side effect if you in a long term you are taking. So
Hmm.
whatever you are taking, that is a medicine. And whatever, if you are having the two breaths extra than your capacity, you know that your stomach is upset.
Hmm.
The same rule
So,
happened with the medicine also. After the
right.
3 months, you should not. You have to take a break for at least 1 month.
Okay, so I want to also understand, because in majority of the Indian households, and now I see in Western world also, I have seen that people have started using turmeric a lot in their day-to-day cooking. But there is also one contradicting fact that one should not be taking medicine regularly if that turmeric is being used as a medicine. So, do you agree the practice that we Indians household have to put turmeric every day, to put jeera every day, to put spices every day in the food that we cook? Is it the right practice?
See, this is the factor of how your DNA match with the things. So according to your culture and according to your geographical situation, the herbs which are there you can utilize to digest the things. Just like if you go to the China, there is every time they are having a liquid which is a digestive for them, and they can eat the noodles every time. But if every anybody else who is from the India eating the noodles every time, they have the gastritis issue. So basically same thing, turmeric can utilize, it have a very good benefits, but not in a huge amount by the other people who are not habitual to that. Just like
Right,
the staple food, that's why we are utilizing the word staple food. If
right,
we move from one country to another country, there is just like the jet lag, there is the constipation.
right,
So to avoid this thing, we the one most important home remedy what we suggested to everyone, that a teaspoon of the castor oil and 2 pinch of the ginger powder, dry ginger powder. If you are having with a glass of water, your jet lag is also removed and your constipation is also gone.
huh.
So,
But the problem is you cannot carry castor oil with you while traveling internationally. You
but
have to
everywhere you
find
can
castor
get.
oil in a different country. Yeah, which
Yes,
is
you can
again
get
a challenge.
everywhere. Yes,
Yeah,
yes, you can get the castor oil everywhere because castor oil is the only one oil which is not absorbed in your stomach. It
right.
is just work as a lubricant. Yes.
Thank you. Thank you. Thank you so much for your advice, sir. And we request you to stay with us because we are coming up with one more presentation.